A sitting transfer for an intubated infant requires a parent and at least 2 nurses. If your patient has a Foley catheter or chest tube, a third nurse might be beneficial, though it's not necessary. One nurse should be solely responsible for the endotracheal tube and nothing else, while the second nurse should be responsible for picking up the baby and transferring him or her to the parent. You'll need to pop the top of the giraffe to complete this transfer. First, gather your tubing and wires. Make sure if the baby has a Foley or chest tube that it's not tied down or connected to the bed. Ensure that your feeding tube, repogal, and inline suction are disconnected. If you find it easier to disconnect the EKG leads and pulse ox, you may do so, but be sure to reconnect them as soon as possible. Next, disconnect your baby from the ventilator tubing. This prevents pulling or tugging on the tube during the transfer. Gently lift the infant off the bed and place the infant on the parent's bare chest. For a mother, the infant will go between the mother's breasts. She should not be wearing a bra of any kind. Reconnect your baby to the ventilator and cover the baby with a blanket. If your patient is a preemie, make sure they also have a hat on. Secure the ventilator tubing with blue clamps and a gauze to the mother's shirt. Do not clamp it on blankets. It must be connected to the mother to ensure the tube does not become dislodged. Make sure to reconnect any tubing or lines that you may have disconnected before the transfer. If your patient has a Foley or a chest tube, ensure that the tubing is not kinked and is at the appropriate level. Let the parent know that if they need to shift or reposition themselves, it's important to call the nurse for help. A standing transfer for an intubated patient requires a parent and at least 1 nurse, but 2 are still preferable if your patient has a lot of wires and tubing. Like the sitting transfer, the giraffe top will need to be open. In this situation, the parent stands at the bedside and lifts the baby up themselves and places the baby against their bare chest. The chair must be placed directly behind them before this transfer begins. The nurse will be responsible for holding onto the tube while the parent lifts the baby. Together, they move as one unit and the parent sits down directly into the chair. It's best to have 2 nurses for this transfer as well, so 1 nurse is able to hold the tubing and wires and reposition the chair if needed. But if the staffing doesn't allow for this, 1 nurse is all it takes. Once the parent is sitting, reconnect the baby to the ventilator tubing and secure it to the parent's clothing with blue clamps and gauze. Make sure the blue clamps are secured to the parent's clothing and not the blanket. Ensure the baby is covered with a blanket and a hat. Remind the parent that if they need to shift or reposition, they should call their nurse to help assist them. To transfer your patient back to the omnibed, first ensure your wires and tubing are disconnected where appropriate. For example, your NG, repogal, and inline section. You may also disconnect the EKG leads and pulse ox if it makes things easier. Just remember to reconnect them once the baby's back in bed. Next, disconnect the baby from the ventilator tubing and have the parent stand. It's easier to have a second nurse assist them. Ensure the baby's nurse has control of the endotracheal tube while standing and transitioning. Have the parent step toward the omnibed and gently lay the baby down. Reconnect the ventilator tubing and anything else you may have disconnected before or during the transfer. Reposition the baby appropriately and close the top of the omnibed.